So HER2 expression on a tumor, typically we've looked at it as positive or negative. But now with the use of antibody-drug conjugate like HER2, I think we're starting to understand that it really is a continuum of HER2 expression, and that even lower levels of HER2 expression can determine that a patient may benefit from some of these newer antibody-drug conjugates like HER2. So in terms of the Destiny Breast 06 data that is presented, in which the data will be presented later in ASCO, but at least per the news release that there's an increase in median progression-free survival in those patients that are HER2-low as well as HER2-ultra-low, I think clearly shows that not only is it important to make sure that we have adequate HER2 testing, but making sure that our pathology partners are really, evaluating for HER2 expression, and even if there's a little bit of expression, not calling it negative instead of, 1. Typically, when pathologists have been evaluated for looking at a kind of their agreeability for HER2 expression, 3 versus not 3 has been pretty clear. Those patients that are 2, again, is relatively clear. But there's been a lot of inter-rater variability between 0 and 1. And so I think the Destiny Breast data clearly shows that that distinction between 0 and 1 is probably more important than previously understood. And so from a community oncologist perspective, I think it's really important to make sure having those discussions with the pathology team about whether there's truly 0 or if there's even just a little bit of HER2 expression, because if there is, the patient may actually gain benefit from HER2, and that would be an important agent to make sure that's part of the treatment plan.